We don't want clinical research to change your life. We want it to enhance your life and be able to live the life that you want to live. I grew up in New Jersey with my parents and my brother in a very rural, peaceful part of New Jersey. My high school was surrounded by cornfields. I'm a very nurturing, compassionate person at heart. I always thought that I was going to be a nurse. After about a year of nursing school, I realized what research was and all the different careers that still allowed me to be in a hospital setting and have patient contact. I always had the dream to work in New York City, and I was very fortunate to be able to live that dream as a clinical research coordinator. Here at Mount Sinai, I work with our hematology and oncology group that specializes in MPN and leukemia. I'm in charge of our team of clinical research coordinators. I also manage our investigational clinical trials. We have probably 15 active clinical trials. We like to have a clinical trial for every patient that can walk through our door, because that study can change that patient's life. When patients hear clinical trial, they often feel overwhelmed because, it's a last-ditch effort. So when I discuss it with patients, I first let them know that what we're giving them is specific to them and that this will fit their life. It mixes standard of care with a new drug. We're trying to see if it helps you. MPN patients are probably some of the smartest patients you'll ever meet. They're very attuned to what's going on in the clinical research world, and they'll often come to us and say, I saw this trial, and do you have this open? Or, what do you think of this for me? And oftentimes you'll hear patients saying that they're doing this for other patients because this might not help me, but it could help someone else. Patients are why we're able to get new drugs approved. And our team is very acutely aware of that. I love that we are, we're being part of moving the science forward. It's a very emotional job because you're with patients that have gone through many lines of therapy. I think for me, that's like my biggest calling, working with these patients and finding a study that works well with them and with their life. I feel very fortunate to be in this position and to work with these patients. This job is the greatest honor.